Good evening to everyone and welcome to today's session. Good to see Vayan and many more. Ashk, Ami. So please inform your classmates that we are on with a daily live session. In about 40 hours, we are going to complete 2000 MCQs in preventive medicine from the past 15 years of the question papers topic wise. So let's make the great beginning, doctor. Yes. Very good to see a lot of you answering the quiz of 50 questions. The one who topped, definitely a big congratulations for the one who topped, and thanks to all who participated. And the one who topped, please call our helpline and get a subscription to onlinembbs.com video library. Now, doctor, preventive medicine definitely is the most boring proposition to prepare alone. So that is the whole purpose of all of us to meet. Now, a diagnostic test has been introduced, and that detects a disease 1 year earlier than it usually detects. So, what is the most likely possibility to this disease within the 10 years after the test is introduced? So, what is the impact of using a diagnostic test that brings a lead time? Lead time is a very important question. So that will make the survival rate, apparent 5-year survival rate, to increase. So what is the meaning of 5-year relative survival rate, apparent survival rate? The percentage of the patients with the disease who are alive 5 years after the disease is diagnosed, divided by the percentage of the general population corresponding sex and age who are also alive after 5 years. That is called apparent survival rate. So you have used a diagnostic test. Good to see Dhanalakshmi online. So you have used a diagnostic test, and this diagnostic test has given you a lead time of 1 year. In advance, you are able to identify. So obviously, that will improve the apparent survival rates is what you have to appreciate. If the prevalence is very low compared to the incidence, what is the meaning of it? All of you know prevalence is equal to incidence into duration. So incidence is increasing, but duration is decreasing. What is the possibility? There are two possibilities. Incidents are all new cases. Maybe because of that people are dying, so duration decreased. Maybe the treatment cured them, so duration decreased. Anything that decreases the duration will affect the prevalence is what you need to remember. So prevalence decreased means though the incidence is increasing, the only reason is because of a decrease in duration, and decrease in duration can occur because the disease is either too fatal or it is usually curable, is what you need to appreciate. The incidence rate of the disease is 5 times greater in the women than in the men. But the prevalence is not showing any sex difference. So if you look at the prevalence in the men, prevalence in the women, in both of them incidence into duration. These are men, these are women. So incidence in the women is increased. Incidence in the women is increased. What do you expect then? The prevalence in women should increase. But though the incidence increased, the prevalence did not increase. इसका मतलब, in the women, though the incidence increased, the prevalence did not increase. That means the duration might have decreased in the women. Duration of the disease has decreased in the women. And the reason for a decrease of the duration in the women could be because of the high case fatality, higher case fatality, so that more women are dying because of the disease. So that is what we need to remember. Every time examiner, on the same fact, he will be mumbling, tumbling and rumbling. You should be very sure how to attack the examiner in the tomorrow's exam. So could you be able to follow this question clearly? Incidence बढ़ने के बाद भी प्रिवलेंस नहीं बढ़ रहा है, इसका मतलब ये ही होता है कि ड्यूरेशन कम हो रहा है. ड्यूरेशन क्यों कम होता? खाली दो चीजों की वजह से कम होता. एक, maybe the disease is highly fatal, or maybe the treatment has cured the people. So that's what you need to remember. Good to see Mia, Umar, and 11 more who are all online. Now, prevalence of a disease is a balance between incidence, mortality, and recovery. A village has 1,000 population. These are the results. So what is the prevalence he is asking? So कितने लोगों को disease है? पूरा old and new cases लिए तो. So disease is present in 180 plus 20 is equal to 200. Divided by total population कितना है? 180 plus 20, 200 plus 400, 600 plus 400, 1000. So 200 divided by 1000. 200 divided by 1000 is equal to 20 by 100. That is 20%. Is the prevalence, is what you need to remember. So the number of new cases is a measurement of the incidence. So incidence is only new cases. And between the incidence and the prevalence, how do you know the relation? The product of incidence and mean duration will give you the prevalence. Prevalence of the cataract at one given point of time. How can you be able to determine? A very important question. So, doctor, I request all of you, before we start the discussion, there is a quiz. Once you play the quiz, this discussion looks very interesting. Because already you try to chase the questions, clean bold in some of the questions. That is a way we all need to improve in our preparation. The quiz is a tool to ignite the competitive spirit for you to prepare. So, doctor, the prevalence of the cataract at one point of time can be determined by cross-sectional study. Cross-sectional study. Now, the district has a total population of 10 lakhs. Under 6 population is 30%. Prevalence is 0.8 by 1000. So, how many total number of blind are there under 60? So, once more, पूरा total population कितना है? 10 lakhs. उसमें से under 16 30% कितना होता है? 3 lakhs. बराबर? So for every 1000 population you have 0.8. 3 lakhs में कितना thousands होता बेटा? How many thousands make 3 lakhs? 300,000 makes 3 lakhs. So for every 1,000 you have 0.8. For 300,000 you have 300 into 0.8 is equal to 240 is the answer. हम फिजिक्स केमिस्ट्री कितना बड़े बड़े एग्जाम्स लिख के टाइट फिल्टर पास करके एमबीबीएस में आया, उसके सामने ये तो बहुत छोटा छोटा प्रॉब्लम्स है, राइट? नाउ in a town of population of 5,000, 500 are already myopic. The new myopic cases are 90. So what is the incidence? जब भी incidence का calculation होता है बाबू, numerator होता है only new cases. So total population कितना है? 5,000. 90 by 5,000 into 100. शून्य 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 90 by 50. So that's how you need to calculate. Now about the incidence, what is false? Typically, in fact, false except means only true. Incidence is not affected by duration. Prevalence is affected by duration. The population are 5,000. Number of new cases of TB are 500. Old cases are 150. What is the prevalence? 500 plus 150 divided by 5,000 will give you 13%. So when you are calculating secondary attack rate, what is the formula? What is there in the denominator? So typically, एक परिवार में पिताजी दशरथ महाराज हैं, उनके बेटा राम है, लक्ष्मण है, भरत है और शत्रुघ्न भी. Ram has caught infection and brought corona to the home. All the remaining 3 are susceptible and exposed. So denominator may only you will take all susceptible among the close contacts. That's the point you need to appreciate. So the number of exposed people developing the disease within the range of 1 incubation period, that's what you need to remember. Right? So, and what is there in the denominator, doc? The total number of persons who are exposed to the primary case. That means only secondary cases. I mean, people who are at risk, they are only there in the denominator. So the number of exposed persons, even this is also risk cases only. So primary case is not included neither in the numerator nor in the denominator, and median and the range of 1 incubation period. So that is the point you need to basically remember. So what is an attack rate going to tell you? Attack rate is going to tell you about the incidence of the disease. So incidence is calculated from prospective study. So if you are doing a cohort study, you are following the cohort over a period of time, नया cases क्या आ रहा है समझ में आएगा. That's the reason incidence rate is only calculated by prospective study is what you need to remember. So every time examiner यही बात घुमा के पूछेगा and you need to answer. Cohort study में incidence rate can be calculated. Attack rate is basically a incidence rate. The secondary attack rate of measles is more than mumps. इसका मतलब क्या है? Obviously, secondary attack rate is the disease which is being detected in the people who are contagious. That is, exposed to people who are developing it. That's the reason. Because the measles is more infectious than the mumps, the secondary attack rate of the measles is more than the mumps is what you need to remember. Now, what is an index of communicability of an infection? Secondary attack rate. So if there is a high prevalence, क्यों होता है? The longer the duration, because prevalence is equal to incidence into duration, is what you need to remember. So what is an index of communicability of an infection? Communicability. Once more, it is the secondary attack rate which is the indicator of communicability. If the changes in the pattern of the disease prevalence is occurring over a long period of time, what is that called? It's called a secular trend. Point source epidemic क्या होता है? Typically, when there is an explosive rise of the cases suddenly, they say corona cases happened in China. Epidemic curve rises and falls sharply. Clustering of the cases are occurring within short period of time, and all cases within one incubation period. That is called point source epidemic. Once more, in point source epidemic, there are no secondary waves. There is no plateau. It is not propagative, and all cases occur within one single incubation period. That is what you need to understand. Then point source epidemic say rapid rise, rapid fall is point source epidemic. So point source epidemic is rapid rise, rapid fall. Secular trend typically is long-term changes. And secular trends are those progressive changes occurring over a long period of time is what you need to remember. 20 pregnant women were asked about the history of smoking when they came to the antenatal visit, and then followed up to see how many of them had low birth weight babies. What is this kind of study? This is an example of a prospective cohort study, is what you need to remember. In Bhopal gas tragedy, suddenly there is a rise and fall of the cases. That is called a point source epidemic. Acha bhaiya, types of epidemics. By now you understood. Types of epidemics is the favorite area for all the examiners. Common source epidemic, which is single exposure or point source epidemic. It can be continuous or multiple exposure epidemic. Then propagated can be person to person, arthropod, vector, animal, reservoir, anything. Mixed epidemics. Then you have prosdemics. A prosdemic is a slow modern epidemic which is non-communicable. Now in the common source epidemics, if we talk, it can be single exposure point epidemic where the exposure is brief, concurrent and simultaneous. All cases develop within one incubation period. Food poisoning epidemics are example there is a rapid rise, rapid fall, no secondary waves is what you need to remember. So this is how within one incubation period all the cases will develop. Then continuous or a repeated exposure. So typically they can result from the contamination of the environment by the industrial pollutants. Mnemonics disease in Japan from consumption of the fish containing high concentration of high methyl mercury is a classical example. Now, common source epidemic. It can be continuous or repeated exposure. The exposure from the same source may be prolonged, continuous, repeated, or intermittent. And there is no explosive rise in the number of cases. That's the point you need to appreciate. So this is how the secondary cases can occur in case of a epidemic curve of repeated exposure, like a water well exposure. So all this theory in the preventive medicine we have discussed in a great detail in the theory part in the online mbbs.com video library. Doctor, take this as an opportunity to be strong in the areas which demand a depth and repeatedly asked in the exam. Right now, seasonal trend क्या होता है? So basically, seasonal trend is seasonal variation of the disease occurrence related to environmental condition. Like when there are floods, when there is a winter, there's an influenza, there's a cholera. They are the example of seasonal trend. Descriptive epidemiology, it includes retrospective and prospective study. No secondary waves, uniform curve is an example of point source epidemic. In the point source epidemic, typically plateau is not seen. Secondary waves are not seen. All cases occur simultaneously. So food poisoning, what is an example? One of the favorite questions of the examiner. It is a common source, single exposure epidemic is what you need to remember. About the secular trend, what is true? The changes occur over a period of decades in a particular direction. That is basically called the secular trend. Rapid rise and fall in epidemic curve without any secondary waves. That is called point source epidemic of single exposure. Single exposure. Secular trend is one direction, consistent change. Two important buzzwords. If the disease occurs in short period of time, you call it as cyclical trend. Now, what are the ways to reduce the bias? Bias is another favorite topic of the examiner. Different types of bias, etc., etc. So totally there are 2000 MCQs, doctor, that we are going to discuss in preventive medicine. Already we finished about 250 questions. 1/8 of download is over. Totally 40 hours. You need to stay with me on this. I'm going to make you champion in the sleep promoting medicine. Now, all this reduce the bias. Blinding, randomization, matching, all this will decrease the bias. So the systemic distortion of the retrospective studies that can be eliminated by a prospective design. क्या होता है? भैया रिट्रोस्पेक्टिव स्टडी क्या होता है? केस कंट्रोल स्टडी. प्रोस्पेक्टिव स्टडी क्या होता है? कोहॉर्ट स्टडी. So what type of bias which is there in the case control is prevented in the cohort. In cohort, what you are doing? For a period of time, you are following a person regularly, seeing how that person is progressing. Let us say nutrition and obesity you want to study. कितना इडली खाए तो आदमी पूरी के जैसे बड़े होगा? You want to make a study. Let us say how many idlis will make you fat. So every day you are going to the person and saying, "Sir, आप कितने इडली खाया?" मैं 10 खाया हूँ रे. कल और पूछा, सरकार आप कितने इडली खाया? मैं 20 इडली खाया हूँ रे. अभी नहीं देख रहे क्या? मैं अभी भी खा रहा हूँ बोलेगा. Very good. That's fine. That is how a cohort study continues. Whereas case control में क्या है? एक मोटा वाला गब्बर सिंह बैठ गया. उनसे आप पूछ रहे, गब्बर जी आप कल कितना इडली खाया? गब्बर सोच के बोलेगा मैं कितना फीस खाया रे। गब्बर ये अगस्त 15 को कितना खाया अपने इंडिपेंडेंस डे को, जब बस सोच के बताओ ना। गब्बर सोचेगा और बोलेगा करीबन 15-20 खाया होगा। So, in case of a retrospective study, case control study, people don't remember what we have. Can we remember what we have eaten for breakfast day before yesterday? No. So, recall bias, which is the problem in a retrospective study, is eliminated by doing a prospective study, is what you have to emphatically remember. Very good to see Ammaji Nagreddy. Congratulations, I heard a very good news that you joined post-graduation. Really proud of you, Dr. Nagreddy. And Dhanalakshmi, Mia, Umar, and everybody, I like to tell you, once upon a time, last year, Ammaji Nagreddy and a lot of students, just like you, were sitting thank you, Nagreddy, for the kind words. I'm so good to know that you joined in psychiatry in Visakhapatnam, Andhra Medical College. Excellent, doctor. Very proud of you. Whenever I come to Visakhapatnam to deliver a lecture, I love to meet you and then like to know how your post-graduation is progressing. Right? Psychiatry is a beautiful subject, and every human being has a corner of depression, corner of melancholy, corner of sadness, and corner of mania. So they are all psychotic in different shades. So it's good that psychiatry is a very analytical subject, just like general medicine, right? So now, doctor, the ratio between the incidence of the disease among the exposed and the non-exposed, what do you call? Relative risk. It is also called risk ratio. Whereas attributable risk is called risk difference, is what you need to remember. Hawthorne effect का मतलब क्या होता है? Suppose you are doing a study on a group of people, you are following the people. There will be an alteration in the behavior of the people because, oh my God, I'm being observed. I'm being observed by this particular researcher. The moment they know that you are observing them, that changes suddenly their behavior. Such an effect is called Hawthorne effect, is what you need to remember. A study compared 150 children with a particular disease with 300 disease-free children. So disease-free होता है controls, जिसके पास disease है वो होता है cases. So मरीजों और मामूली आदमियों को compare कर रहे तो आप इसको कहते हैं case control study, is what you need to remember. Which is not a cause of bias. Bias can be because of confounding effect, selection bias, misclassification bias. Suppose you are doing case control study. Control means completely free of disease, case is completely having disease. But somebody who is in the middle of the two also you brought and made him a case or a control. That is called misclassification bias, is what you need to remember. Now you are able to see the breast cancer patients in a clinical trial. 1,000 healthy women were given the drug and 1,000 were given a placebo. Accordingly, thank you, Ammaji Nagreddy, for a kind words. I have only believed you and learned your classes during all evenings and completing all your bits in online MBBS and your lecture notes. Very thankful to you. Actually, I want to commend, oh no, please don't say that, doctor. And I'm really humbled. In fact, every day evening when the class starts, I used to wait. Where is Ammaji already joined or not in the last days, last year? So thank you so much. It is the same good feeling as a teacher, me, as the students, you. Every day carry that admiration, adoration mutually, and we all get inspired to study together every day. That is the only way by which we get a salvation from this sojourn of journey and a war called as NEET PG medical entrance exam, doctor, right? So thank you, Ammaji, for that. Now, so doctor, what is the relative risk? Relative risk in this case. So basically you need to know cases, controls, exposed, unexposed, A, B, C, D. So basically A by A plus B, C by C plus D will give you the relative risk. Just you need to do those calculations in this table and you are getting the right answer. A study began in 1970 with a group of 5,000 adults in Delhi who were asked about their alcohol consumption. And you have done a study on their cancer. So what is this an example of? It is an example of concurrent cohort study is what you need to remember. So doctor, you should know cross-sectional versus longitudinal. Cross-sectional versus longitudinal. Cross-sectional study is conducted just one point in time and longitudinal for a period several points in time. In cross-sectional, you will be following different samples, longitudinal, same sample. Snapshot at a given point in time is cross-sectional and longitudinal, you are following change at the individual level. The hospital conducted a cohort study of 7,000 subjects who were smokers over a 10-year period and find 70 subjects developing lung cancer. So, concurrent evaluation of the general population has shown out of 7,000 non-smoker subjects, only 7 developed lung cancer. So basically, exposed and unexposed cases controls a table मार देना A by A plus B divided by C by C plus D will give you the relative risk. Similarly, doctor, odds ratio calculation. Just you need to know the formula, that's all. So A into D divided by B into C. Once more, you should know based on this data how to draw the 2 plus 2 table about exposed, unexposed cases and controls. Exposed, unexposed cases and controls. So that is how you need to calculate the odds ratio. So doctor, that brings us to the end of the today's journey. Every day evening, कभी-कभी 6 बजे को, 7 बजे को, 8 बजे को, 9 बजे को, depending upon my how much I am tied with many things. Especially now we are doing the testing of the mobile app, Incus quiz app. We are doing the testing phase. So entire night I am awake with the developers, sitting with the developers doing that. That's the reason sometimes my schedule is becoming a little here and there. But by 29th August, most likely we will be launching the Incus quiz app. And within another 2-3 days, we will also come up with iOS app, initially Android app. So look forward for that. Once you are there on the Incus quiz app, almost every hourly you have a quiz tournament to fight with the whole world and know where your score is standing. And if you're standing on the top of that, you get a free subscription to our online mock tests, 65 full scale grand tests. So keep tuned and enjoy a good preparation. Good night.